This feels a little like coming full circle. We wrote a paper with David, with Dr. Satcher in 2005. As co-authors, we published it in the journal Pediatrics. And it was about the need, the critical need to expand our role as health professionals and health institutions to focus on a community level and to focus on partnerships in order to impact the health of kids. And it seems to us that we have collectively been living our way into that vision here in Rochester with many of you together. We have partnered also not just with people, but with institutions, the Children's Institute, the Children's Agenda, Rock the Future, the Rochester City School District, and our regional school districts.
And we would really like to thank and recognize our partners in pediatrics and at the U of R too.
Equity and anti-racism have to start with children and families. And they need to be based on partnership with families and across the systems of health and education and human services. Our former chair of pediatrics, Bob Haggerty, said in 1968, we must become partners with others or we will become increasingly irrelevant to the health of children.
Dr. Sean Nelms shows a slide with a message that both of us have internalized. It's about decision-making, and it says that children and families must be at the moral center for what we choose to do. That seems simple and easy, but it's not. There are things that get in the way, right? Like money and ego and territory. We do not have room for these anymore where children are concerned. It's really only through building new partnerships that recognize families as partners and leaders, as experts of their children and their lived experiences, and through solidifying collaboration across health, education, and human services with a focus on approaches proven to be effective, and with full acknowledgement of the need for systems and policy change, that we will get to a different place for our kids. The most moral thing we can do is partner with families and others to see our children do better. There's a term that captures this approach, and it's called whole child health, a focus on the physical, emotional, and developmental health of a child in the context of their family, their neighborhood, and their community. We recently wrote a vision statement with many of our community partners and colleagues that we, as a Rochester community, will be a whole community for whole children. We believe that can truly happen, again, through partnership, putting what's best for kids at the center of our decisions, doing what's effective, and starting, as Frederick Douglass said, with equity and anti-racism as a priority, beginning with children. We thank you so much for this award and this honor.